So, Myzome, as you know, was approved by the EMEA and FDA in 2006, and there's now over 1,000 patients worldwide, just over 1,000 patients being treated. Clinical trials in infants have demonstrated prolonged survival and improved cardiac and motor function, and the adult study has just been completed. I'll be sharing those results with you tomorrow. The Pompe Registry program is set up and running, and we've just recently launched the Dried Blood Spot Initiative, and I know Alan Cooper will be speaking about this in a bit more detail later on during the course of the day. And as Alan already mentioned, there are also patients that are starting to transition onto home care, and I know we have some representatives from home care companies who will be discussing what that means. So it's around the end of 2007 that the first patients went over onto home care. Increasing numbers are transitioning. We get involved in helping the home care providers understand what the latest data is on enzyme and the latest thinking on Pompe disease. I and my colleague Susie Powell, who's our nurse associate at Genzyme, we visit healthcare at home and carerology and take them through the latest data on a regular basis. There's a number of Fabry and Gaucher patients on enzyme replacement, and so far, from what I gather, there's not too many hurdles. Maybe the reconstitution time seems to cause a few grumbles, but we'll probably hear a bit more about that later. But as far as my understanding goes, there aren't too many major hurdles with the home care, moving to home care. Dried blood spot testing, just very recently launched. It's available principally for Fabry and Pompe in the UK, and labs, I think a couple of labs were already set up, a couple more are in the process of being set up. And it enables a rapid and simple diagnosis for Pompe disease. Very briefly, you stick a needle into a finger, a few drops of blood on this card, you send it away to the lab, and fairly shortly afterwards you get a result on your enzyme levels in the assay. It's just rolled out now, so hopefully that'll become increasingly important as time goes on. This coming week, there's a large conference, the World Muscle Society Conference, which it happens every year in various locations around the world. This year it's actually going to be in Newcastle, and there's a number of presentations and discussions that relate to Myzome or relate to Pompe disease. So I just wanted to share with you some of what's being discussed. For example, there's some information on the Pompe Registry. There are the results of a survey that we ran examining the attitudes of neuromuscular specialists and neurologists' ability to suspect Pompe disease. In fact, my colleague Darren Clarkson, who's the tall chap from Genzyme at the back of the room, if you want to know a bit more about this particular survey, he's been heavily involved with the project. And then the LOT study also, the late onset treatment study, once again I'll discuss it tomorrow, is going to be presented formally by one of the investigators, I believe on Thursday in Newcastle, so to a very wide audience of neuromuscular specialists. Any questions on what we've discussed so far at all? No? Okay. I'll talk a bit about the registry program now. What is the registry? It's an international ongoing observational database. It's open to all physicians managing Pompe. Collect data on all patients, whether they're treated or whether they're not treated. Confidentiality is maintained, and we send reports to the FDA in America and the EMEA in Europe on a regular basis. They want to see cuts of data I think it's on an annual basis, and we compile a report and forward it on to them. It's established in 23 countries around the world. About 60% of patients in the registry are from Europe. There's a number of physicians that are enrolling patients, and the EMEA wanted us to look also at the use of enzyme replacement in women who may become pregnant or during lactation. So this is a specific study within the registry that we're setting up and hopefully we'll be able to recruit patients into at some point. The aims are to enhance the understanding of Pompe disease, evaluate the long-term effectiveness and safety of treatment, help develop clinical practice guidelines. As you know, specialists from around the world get together and write guidelines on how best to manage conditions such as Pompe, and registry data can feed into some of those discussions. They help us understand unrecognised manifestations or complications of the disease, and also, with the advent of treatment, probably what we'll find is that Myzome itself may actually modify the natural history, the course of Pompe disease, and it would be important to understand how that happens as time goes forward. We collect clinical data, blood test data, X-rays, MRI scans, genetic data. We collect prospective data, which means information going forward, and retrospective data, so we can actually go backwards as well. We focus on clinical assessments that are routinely evaluated for patients with the various LSDs. So for Pompe disease, obviously respiratory outcomes are important, and muscle strength outcomes are important. And there's also a focus on quality of life and how individuals function on a daily basis. It works. You have a physician who treats patients, and usually it's not the actual treating doctor. It's normally a research associate or a clinical nurse specialist who inputs data into this computerized database, and then the data gets analysed on a regular basis and then disseminated to the FDA and EMEA, to disease experts and to other physicians who may treat Pompe disease. So that was the setup of the registry, and it started fairly recently, around the time that Myzome was launched, and we've got a few bits and pieces, a few early pieces of data from the registry, which I'll share with you now. These are all the registries. We run a registry in each of the diseases that we produce an enzyme for. So here goes Pompe disease. It started in 2005. There's about 460, it's probably a few more than that now. It's about 460, probably closer to 500 patients in the registry worldwide now, and probably closer to 300 in Europe. So these are quite sizable chunks of data. Now, if you compare it to the GoShare registry, which started 16 or 17 years ago, it's 5,000 patients worldwide. So this is a huge, very valuable database, and I'd hope in years to come we'd have that many patients' data in the Pompe registry, because when you have that larger data set, it's quite valuable in being able to understand disease and progression of the illness. So, enrolment. Started in 2005, and these are the numbers of patients in 6-monthly instalments. So by January 2005, there were about 40 enrolling, and there were 460 patients enrolled at the beginning of this year. This gives a split between the global patients, so patients all over the world, and the blue is the UK. So in 2007, if we look at this number here, there were 178 patients globally were enrolled into the Pompe registry, and 37 in the UK. And so far, up till May 2008, 47 globally and 12 in the UK. These numbers will have gone up by now.